Hey everyone, welcome back to Eye Health Central. I'm Dr. John Legaretta, and today I'm going to discuss something that might look a little scary, but it is usually harmless. Something known as a subconjunctival hemorrhage. Imagine waking up, looking in the mirror, and seeing a bright red spot on the white of your eye. Sounds alarming, right? Well, I'm going to tell you all about it, how it happens, and what you need to know for it to go away. First things first, what exactly is a subconjunctival hemorrhage? It might sound complicated, but it's actually pretty simple. Your eye is covered by thin, clear tissue called the conjunctiva, which has lots of tiny blood vessels. Sometimes, one of these blood vessels can break, causing blood to leak out and get trapped under the conjunctiva. This forms a bright red or dark patch on the white part of your eye, known as the sclera. So even though it looks extremely dramatic at times, it's usually painless and doesn't affect your vision. Think of it like a bruise on your skin, but on your eye. It might look alarming, but it almost always is harmless. So you might be wondering, really, what can cause a subconjunctival hemorrhage? Well, here are some of the most common reasons for it. Number 1, minor injuries. You might get one if you accidentally poke your eye or rub it too hard. Even minor bumps can sometimes cause a blood vessel to break. 2, sudden pressure such as Valsalva. Things like sneezing, coughing, or even straining during bowel movement can cause a sudden increase in pressure in your head, which can make a blood vessel in your eye burst. 3, medications. Blood-thinning medications like aspirin or anticoagulants can make you more likely to get a subconjunctival hemorrhage because they reduce your blood's ability to clot. 4, medical procedures. Sometimes procedures like eye surgery or even using certain eye drops can cause this condition. And finally, idiopathic or unknown reasons. Sometimes it just happens with really no clear cause. Additionally, there are also some risk factors that might make you more prone to getting a subconjunctival hemorrhage. Age. Older adults are more likely to experience this condition because their blood vessels become more fragile over time. Underlying health conditions. Conditions like high blood pressure, diabetes, or bleeding disorders can increase your risk of developing this. Now let's talk about symptoms. The main thing you'll notice is a bright red patch on the white of your eye. It will look scary for some, but it usually doesn't hurt. Most people don't experience any pain, vision changes, or even eye discharge. And honestly, you might not even realize you have a subconjunctival hemorrhage until you look in the mirror or someone else points it out to you. The redness can be really small, or it can cover a large part of the white part of your eye. And the good news is doctors can diagnose a subconjunctival hemorrhage just by looking at your eye. Usually no special tests are needed. However, if you have frequent hemorrhages or other symptoms, your doctor might start checking for underlying conditions like high blood pressures or a bleeding disorder. And really, here is the good news. Most of the time, a subconjunctival hemorrhage doesn't need any treatment and will go away on its own. It usually takes about 1 to 2 weeks to completely heal, and even sometimes longer if it's a very large hemorrhage. The red spot will gradually change color, much like a bruise on your skin, as your body absorbs the blood. So here are some tips to help manage it. Avoid rubbing your eyes. Rubbing can make the hemorrhage worse or cause another one. Use lubricating eye drops. These drops can help if your eye feels dry or uncomfortable, but they won't speed up the healing process. They will just keep the eye more comfortable if there's irritation. And you really need to manage your blood pressure. So keeping your blood pressure under good control can really prevent future hemorrhages or the current hemorrhage from getting worse. And if there was any trauma involved, you need to protect your eyes. Wearing protective eyewear during activities that can cause eye injury can help prevent the trauma that may have caused it in the first place. It's also a good idea to keep track of any medication you're taking and talk to your doctor if you're on blood thinners, as they can increase your risk of bleeding. I usually tell my patients to limit the use of aspirin and NSAIDs unless necessary for treating existing conditions while the subconjunctival hemorrhage is present. While a subconjunctival hemorrhage is usually nothing to worry about, it's important to get checked by an eye care provider. If you notice pain, vision changes, or if you're on blood thinning medications and have frequent hemorrhages, seek a healthcare professional to rule out any serious conditions. So, to recap, a subconjunctival hemorrhage looks scary but is usually harmless and goes away on its own. Just take care of your eyes, manage your medical conditions like your blood pressure, and avoid rubbing your eyes. If you found this video helpful, please give it a thumbs up, subscribe to our channel for more eye health tips, and leave any questions or comments down below. And don't forget to check out our other videos on eye health. Thanks for watching, and I'll see you next time.